from hospital to community. So how do we get people out of being in secondary care? How do we start bringing virtual hospitals, caring and hospital in the home?
Hello and welcome to this edition of the Health Beats podcast. My name's Steve Gardner, the Managing Director of Healthcare World magazine, and welcome to one of the world's leading international healthcare business podcasts, supported by in association with Abu Dhabi Global Healthcare Week. Today's edition of the podcast is a really exciting one that I've been looking forward to a while. Good friend of mine, great leader in the healthcare space, a truly inspirational individual. Jacqui Rock, who will tell you yourself in a moment, has had a storied career, has done some really interesting and exciting things across the UK NHS, the Saudi Healthcare Transformation Programme, and even a stint working with the Ministry of Defence and the security services in the UK. Jacqui, how are you? How is Riyadh? And how are you doing?
Hey Steve, it's great to see you, and hi to everybody that's listening in. Riyadh is great. It's a wonderful time of year. Weather's really quite clement at the moment, and having a really good time just settling into new role, new country.
Fantastic. And it's been quite a journey, hasn't it, to take you there? And I think the place I wanted to start with this conversation really is your personal journey, because you've done a lot. You've had a fascinating life, a fascinating career. Do you want to give us the potted history of Jacqui Rock?
Yeah, the potted history. I think it all starts way back in the day. Now, I've always been a grafter, right? I'm really proud of that. In terms of, I really believe that just hard work and just that tenacity to just keep going is what has given me all the opportunities that I've had over my career. I was really lucky. To be born in London, and brought up in London, and I say that I was lucky because being in so close to a capital like that gave me lots of opportunities. I could be into the city of London within sort of 15 minutes on a bus, and so especially in the early 80s, which is when I first started my career, there was a lot of opportunities. And that's how I found myself going into banking. Literally, it was going around and sort of knocking on doors. And saying, you really need to take me on. I'm really something quite special. So I had a wonderful career in banking, well over sort of 27 years, and worked for major organizations, JP Morgan, Credit Suisse. And the final role was the chief commercial officer of Bank of America, Merrill Lynch. Really fortunate. Just being in financial services gave me the opportunity. I think last time I added it up, I traveled to 52 countries with work. What an amazing experience. Had teams all over the world. Really very lucky and very blessed.
So how do you feel that background in banking prepared you for the second career in the public sector and then moving into healthcare?
Yeah, and it was always really interesting. There's not that many of us, there really isn't, that move from financial services, for example, into the public system, into the government. But all the skills are completely transferable. They're all, everything I knew about money and running a business and commercial is exactly the same things that I brought into the government. And actually, it was the government that came after me because sort of 10 years ago, His Majesty's government were looking at building out their commercial skill set, their commercial capability, and they did an absolute dedicated program to basically go out and headhunt top commercial individuals, CPOs, to come in and bring that skills into the government.
Yeah, I can see how that works. I'm probably in a similar situation with me from a commercial background. Sometimes that kind of commercial, money-led idea of how we pay for stuff and how we make stuff work is kind of what the public sector is missing, isn't it? So what was your first role? How did it all transpire?
Yeah, so well, I was quite lucky. I had a couple of choices, but I thought, well, I've done all these years in banking. Let's diversify, and I went into the Ministry of Defence, which was absolute pleasure. I still feel very passionate about defence. I enjoyed every single day that I was there. I was the Chief Commercial Officer for the Defence Infrastructure Organisation, so I looked after the entire real estate, hard, soft FM, construction in the UK and overseas. So it was an amazing role. I loved it, and I remember thinking after the first sort of, I don't know, I think the first couple of months when I was on a plane going to the Falkland Islands, and I'd been on a nuclear submarine, and I'd been hanging around with the special forces, that I thought I can never go back now. This is really, really exciting and really good, and my skills and everything that I bought was needed, and I had an amazing team. So I would still be in defence now if it wasn't for COVID. And it was COVID that was really my first foray into health. And so people are quite often surprised. So that obviously means I've only been in health for 5 years. But I was asked by the Prime Minister and by the Secretary of State, which was Matt Hancock at the time, if I would come across from defence and help, set up the UK's response to the pandemic, which is exactly what I did. So I went over and set up the test and trace function, and then later the UK Health Security Agency.
And again, I mean, how much you talk about the leap from financial services into healthcare, sorry, into the public sector, and then you make another massive leap from defence into the healthcare space. How big a change was that, and how did you adapt?
It was a big change insofar as, because then I was always, the intention was, like many of us that went and helped with the COVID response, was that we would go back to our sort of parent organisations. So, but I looked at, as I started working in health and realising the opportunities in health, realising where they needed my skill set. That's why I stayed, right? So that's why I stayed and took on the job as the chief commercial officer for the NHS. I mean, I've always been a bit of a chameleon. I think any leader can adapt, right? Any leader can, because it's your core skills that you're taking with you, but you do have to learn a different language.
Yeah.
So I had to learn a different language when I moved from banking into defence. It's a very different way that people talk and the way that people do things. And again, a different language when you move into health. I can talk health now, but those first couple of years took a while, and it's not just being able to articulate about clinical pathways and be able to communicate with clinicians, etc. But it's about sort of understanding how things get done around here.
Yeah, and it's really interesting. I mean, a similar journey myself. I mean, I came into healthcare, from a general publishing background about 15 years ago. It bites you, doesn't it? There's something about healthcare as a sector, that feeling that you are doing something that matters, that's important to your fellow citizens, to humanity. You get fascinated by it and drawn into it. Did you find that? Did you find
I
that
did.
healthcare just grabbed your soul to a point?
Yeah, it did, as did defence. But healthcare even more so. I mean, we all use healthcare. So, the NHS is looking after my 87-year-old mother, my 4 grandchildren, my entire family, me. When I go back home, and when I become an old fossil, but it's that cradle to grave experience that every single one of us. There's not one of your listeners that, even if it's not necessarily the UK healthcare, doesn't use a healthcare service. And a couple of other reasons why I really thought, again, I need to stick with this, because I think that healthcare is one of the least sophisticated ministries, in effect, or functions of a country commercially. I think it is always the highest government spend. Let's not forget that. Undoubtedly, healthcare usually is a higher spend than defence, which is usually the second highest spend. And yet, as I look across healthcare systems across the world, it's probably the least commercialised. So I think, therefore, there's the biggest opportunity, how we can bring in things, how we can do those efficiencies and that productivity, which is going to affect patient care. And I think the other thing that really grasped me was just innovation in healthcare. Every day, every week, I'm really blessed being in a commercial role to just see the amount of technology, whether it be med tech, whether it be pharmaceuticals, wonder drugs, whether it be equipment that is actually coming onto the market now. And the way that we're going to be delivering health in the next 10 years is going to be incredibly different from how it was 10 years ago. It already is. And so again, I'm passionate about those kind of innovations and about how we can leverage just technology, AI, etc. So yeah, healthcare is the place to be to do that.
No, without a shadow of a doubt. Really interesting point that you raise about the lack of commerciality that we sometimes see in healthcare, particularly amongst the kind of clinical population. You, of course, came into one of the most well-known healthcare systems in the world, in the NHS, which has a very, very different funding model to most healthcare systems around the world. And if anything, is probably less commercial because of the nature of all of the funding coming from central government. But is this kind of sacred cow in the UK? What's your readout? I mean, going into the NHS, what were your preconceptions? How did you find the organisation that you joined?
As I said, I'd worked in the NHS in a time of crisis.
Mm.
And so I was always aware that probably wasn't how it sort of functioned in a sort of, if there's any such thing as business as usual in the NHS or any healthcare system, it isn't really like that. So I went in there with the expectation, as I say, of you know the desire is there for change. The desire is there for reform. It's just really tricky. The NHS, we often refer to it as a her, like a boat. She's like 76, 77 years old now. And she's culturally been around for a long time. And really radical reform takes a while to change. But of course, where we are now, and I was very much part of that with our new government and the new reform that everybody is working on very, very hard. I'm really very, very optimistic.
It's an interesting one, isn't it, with the UK? Because the NHS is unlike any other system in the world. It's beloved of the population. It's something that people are very keen to ensure is preserved, and yet its direction is made by government. You obviously, you've recently come out of the NHS, and since you've gone, many of your colleagues in senior leadership are now moving. There's a massive change afoot in terms of the way the NHS is led. How do you see the organisation evolving now?
You're right. There has been a lot of change. There's been a lot of change in the executive team as well. But you know, the 10-year reform, I've never seen so much time and effort and real drive that the current government is putting behind that. I mean, I think you'll be aware that we did a very, very big public consultation the end of sort of next year, where we got responses from thousands and thousands of people, patients, members of the public, our clinicians, our professional services, and all of that is going into this reform plan, which I think they're planning on launching it later in the year, or certainly before the summer. So I'm going to be watching that very carefully. But of course, there's the three missions. Let's not forget the three missions. One of them was from hospital to community. So how do we get people out of being in secondary care? How do we start bringing virtual hospitals, caring and hospital in the home? Really important. The second one of those key missions was from analog to digital. The NHS is way behind where it needs to be, and other healthcare systems, in terms of just really embracing systems, data, AI, technology. And then the third mission was from treating illness to prevention. And every healthcare system in the world, including the Kingdom of Saudi Arabia, is focusing on that. We have to live better. We have to get our populations healthier. We have to get them more health aware. And I think more than any other time in history, with the access to the internet and apps and digital therapeutics, people can really do that. And I think just finally on this point, well, I've got two different hats, right? So as a member of the public, right, and as a user of the health system and the NHS, what do I want to see? I want to see better access to primary care. better access to dental care. I want to see those waiting lists go down, so that when I do need a particular service, it's within a reasonable time frame. And I very much, as a member of the public, want to be able to choose where and how I have that service performed as well. But then when you look at it, that's one hat. And then obviously as a healthcare executive, I want to see the NHS move into a real market maker commercially. I think they are one of the strongest healthcare systems in the world, and they should be dictating what the market builds, drives, drugs, everything, you name it, clinical pathways. So I'd love to see them move into that more clinical and non-clinic market making position of power. And I also think, as a healthcare executive, I want to see a government that actually is brave enough to do radical change. They're saying they're going to. I really hope that is the case. But it is really tricky. It's tricky for any government, regardless of colour. In terms of whether they're Conservative blue or they're Labour red or whatever, because it's like everybody knows things. This is why we do that public consultation. Everyone knows what could be improved, but when we do start improving things and we do start sort of bringing things in, for example, for years we've been talking about, if you don't turn up for a GP or a medical appointment, and if you can afford it, so I'm not talking about people in different circumstances, there's a £10 charge, for example. And as soon as you start thinking about doing something like that, and by the way, this is Jacqui Rock, this is not something that's coming. I just want to make this clear.
Yeah,
this is just an example. Everybody's up in arms, and you see on the beginning at the front of every single newspaper, especially tabloid newspaper, hands off our NHS. And everyone gets very, very upset if you do want to do reform. So I do sympathise with the government. It's a very, very difficult area to tackle.
We had some of the same challenges, didn't we, when we talked about commercialisation? You and I worked together for a period of time talking about ways in which the NHS could share its expertise internationally, for example. And again, there's a certain amount of, oh no, we can't think commercially, and yet we must. Because at the end of the day, the service has to be paid for. And the issue with the NHS has always been one about the fact that, as you say, it's such a big capital expenditure, it's such a big part of the government's budget, and yet, it's not something that's thought of in commercial terms. And then, of course, for you personally, in a career marked by remarkable leaps of faith and risk-taking in moving from banking to defence to healthcare and the NHS, you then made another big leap to go and join the health holding company of Saudi Arabia. Some of the same challenges, I imagine, but also some very different challenges. Tell us why you made that decision.
Yeah, and so I'd been talking to the Ministry of Health and the Health Holding Co. In Saudi Arabia for a couple of years, because we've been working on some initiatives together from the NHS perspective. So I was aware of the big transformation that they were doing out here, and I was also aware. I hope this doesn't sound arrogant, but they didn't have a Jacqui Rock. Maybe that's a good thing. And so when we started having those conversations, and the opportunity therefore came up for me to be part of one of the most dynamic, exciting, fast-paced and biggest health transformations in the world. It's kind of right up my street, Steve. It's still healthcare. It's still about patient outcome. It's very, very lots and lots of similarities to what I'm doing in the NHS. And of course, I'm still very, very deeply connected into the NHS, because there are things that the NHS and the Kingdom of Saudi Arabia are doing in partnership together. So I made the jump, because I thought this is going to be somewhere where I can really affect change. I can be part of something very exciting, and you get to do some things that other countries might not enable you to do. And as I said, I love innovation. I love pushing the boundaries a little bit. So it was absolutely the right place for me to be.
No, I completely understand that. I mean, personal experience of working in Saudi is it's a really fascinating place to be. It's very dynamic. It's a country that is developing, liberalising, and becoming, evolving so quickly. Great place to be. And of course, one of the things that you've got with the Saudi Arabian healthcare transformation is a strategy that has been created and driven, and has direction. It's not going to change. There's not going to be a sudden change of government that changes direction. And from a sort of healthcare geek point of view, there's a sense that you are creating something that is, digitally enabled, AI and data driven, that is going to be a really exciting, and really far-reaching change. Tell us from your point of view. You've been in the system now for what, 3-4 months? Um,
Yep.
how do you see the transformation program working? Give us, if you would, a little bit of a kind of description of what you've seen in the system and how it's working in Saudi Arabia.
Yeah, absolutely. So it is quite complex, but I'll attempt to sort of lay out just the really high level. So let's go back to Vision 2030, which I think most people have heard about, and if they haven't, I do encourage people to go. People have heard of NEOM now. They've heard of some of the really big changes that we're making in culture, in sports. We've got the World Cup coming, in tourism. But when we look at the Crown Prince, MBS's whole vision for the country, the kingdom is really blessed in a couple of things. It makes it really, really quite unique. It is at the heart of the Arab and the Islamic world. We have Hajj here. We have Umrah. It's a really, really fascinating place. It's a unique and strategic location as well, in the centre of 3 continents. So let's not forget sort of where we are and where that allows us to be, and also that really strong cultural heritage. So when they started devising what Vision 2030 would be, it was all about unlocking the kingdom's full potential. And there were three key pillars. One was they wanted to create a really vibrant society. Speaks for itself. The second was a thriving economy, and the third was a really ambitious nation. So Saudi always, there is an absolute desire to do things first, to be the sort of the forerunners of lots of things in lots of industries. And so out of that became 6 strategic objectives. And one of those was offering a fulfilling and healthy life. And so out of that, one of the key programs that came out of Vision 2030 is this health sector transformation.
Which is one of the things that makes it so fascinating, isn't it? I mean, it's interesting. I think one of the things that has come out over the last few years, and obviously you've come in alongside Nasser Al Hakrani at the Health Holding Company with a remit, as I understand it, to accelerate that change. So how are you going about, really kind of putting your foot down on the floor, hitting the pedals of the metal, so to speak? How are you driving that pace of change? There must be so many things going on and so many things in train at any given time.
Yeah, I mean that's a really good sort of leadership question, really. How do you not get stuck in that strategy space, right? Because you can do, right, and there can be a million brilliant vision and mission statements and strategy statements, etc. But we really need to be in a place of action right now. So, which is good because that's my comfortable space. And I've always found that just literally, yes, we've been talking about this, but I want some action now, and so I drive outcomes all the time. Just give me something tangible. I don't want to chat about it, whether it's suppliers coming in and talking to us, whether it's other areas of healthcare, whether it's pathways. So I think that's the answer. I'm just incredibly outcome driven and focused, and I need to see, because I need to add value here. Everybody needs to add value here. We need to be, the kingdom's brought me in for who I am and my knowledge and my skill set, and I need to add that value. I need to make sure that, and that has to be outcome delivery, not another set of nice PowerPoint slides.
Yeah, I think there was a point in the transformation program where it did feel a little bit like we were circling around with one PowerPoint after another. So it's nice to hear that you and NASA are giving it that kind of operational energy. I think the other thing, of course, that you were brought in for were two things really: your international knowledge and experience, and the ability to engage with international markets, particularly the UK, and that point around innovation, and particularly innovation in the digital space. What are you doing yourself and as an organisation to try and embrace that technology and data-driven agenda?
Yeah, really, really good question. As I said, I sort of talked a little bit about technology already in terms of what we've already got here, but now starting to look, and so I'm being very deliberate. We're looking at kind of how we use AI in absolutely every area of healthcare, and working with big global partners to do that as well, because you know this is always the I say it's the tricky thing, but whenever you're rolling anything out in healthcare, ultimately it impacts patients, and ultimately it impacts people's lives. It saves lives, or indeed won't save lives. So whilst we want to be, healthcare around the world wants to be quick and agile, sometimes we can't be as quick and agile, for example, as the financial services, right? Because everything needs to be tested and everything needs to have, lots of accreditation, and it's no different here. But to make sure that we focus on those key things that we're watching around the world that other people are implementing, and we put a lot of focus and effort into that. And I think data is another similar thing. Um, Healthcare data is phenomenal in terms of what you can do, but I quite often come up, especially with clinicians who feel very uncomfortable about it, whether it be patient confidentiality, whether it be patient consent to use data, even if their name's not on it. So it's a tricky area, but we've always been healthcare's always been incredibly successful at using data because that's how we do research. All right. And you look at what we're doing around genomics, you look at, all over the world.
It's fascinating. I mean, Saudi Arabia is going to be hosting the World Cup in a few years' time, but it almost feels like between the Hajj and Umrah pilgrimages, it's almost like Saudi hosts the World Cup every year,
Yeah.
given the
Yeah, that's a
size
good
and
point.
scale of the healthcare challenge. And it's also, it's not just about providing their healthcare, is it? It's a massive public health challenge.
Yes, it
How do
is.
you get these people in and out? Make sure that they have access. Make sure that the messaging is right. I mean, where do you even start with something like that?
Yeah, indeed. And we've got incredibly dedicated teams working on lots of different initiatives. And I think some for Hajj this year, there'll be some new health initiatives that are definitely going to be. I'm not at liberty to say it yet because it hasn't been published, but you'll be seeing some new exciting initiatives there, definitely.
No, absolutely. Look forward to that, and hope you'll tell us about them as
Mm.
soon as they happen. I want to go back to this point about commercialisation, though, and internationalisation, because that's
Yeah.
part of your DNA, isn't it?
Mhm.
And I think that people look at the opportunity in the kingdom and look at the opportunity to come into the kingdom, whether as suppliers, whether as providers, but there's also a big investment opportunity, isn't there, in Saudi Arabian healthcare? How are you going to go about thinking about that, promoting that? Providing that opportunity to investors from around the world to get involved in the healthcare system in Saudi Arabia.
Yeah, really good question, and something I'm it's really at top of my priorities right now. So what's really interesting is and what we're blessed with is the world wants to come and talk to us.
Mhm.
So every provider of any kind of healthcare services, data, workforce, med tech, pharmaceuticals wants to come in and have that conversation. And it's really important for me. I sort of prep them before they come in, and I say, you need to come in with a partnership and an
Mm.
investment mindset. Do not be coming in thinking that this is going to be a purely sort of vendor and transactional relationship. Um, because it isn't. That's not what we're looking for. We are looking for we are looking for organizations that will invest in us, will work with us, and then the return of that is you get a very long term relationship with us. So it's not just a question of here's a couple of years contracts, and off we go again. We're in it for the long term with people, and people, and suppliers will often say to me, "Well, Jacqui, we don't know what you want. What is it that you're looking to? Which particular areas?" So we're focusing over the next sort of 2 or 3 months in making sure that we can be very sort of public with our pipeline. Because I think it's tricky for people to come in when we haven't indicated to the market what areas and what things and what particular initiatives. So I'm going to be doing that. So that's because I think that's the first thing. Let the market know what you're interested in, what particular areas are priorities for you, and the market will always respond. And then come in with an investment partnership mindset with us, and then we can absolutely do great things together.
I think that's a really, really important thing. I mean, it's something that I advise friends and colleagues, businesses that I work with when coming to Saudi Arabia. Don't pitch. Don't go in there with the idea that you're selling something to Saudi Arabia. Go in there with that mindset of how do we work together to create something which between us is kind of bigger than the sum of its parts. That to me is the Saudi
Absolutely.
mindset. It's a real thing.
Yep, spot on.
Yeah, and I mean, and from that point of view, do you have any sense in your mind of where are the key areas of that pipeline? What are the key things that the kingdom is interested in? Is it about technology? Is it about provider organisations? Is it about pharma and medtech? What are the key things that the kingdom is looking for at the moment?
Yeah. So my easy answer is everything, but I know that doesn't necessarily help. And as I say, once we go out to market, we'll be able to be a bit clear on that. I mean, for me personally, one of the things I'm focusing on right now is looking at the data. What do we buy? Who do we buy it from? And therefore, where are those real, just obvious opportunities for us to optimize, do better, bring in innovation. So I'm working through that, and I'm literally looking at all categories, medical and clinical and non-clinical, literally every single category at the moment. But there's some really obvious ones. There's always real obvious ones in terms of logistics. There's because it's a very big country and we have to move logistics around a lot. There's definitely in terms of imaging equipment, maintenance of those imaging equipment. So I've got a couple of categories that I'm sort of already starting to see. I think that might be something that we absolutely want to put as a priority. But until I publish that, until I come out with that kind of that list and that priorities, it's I certainly wouldn't say that things aren't on the table.
Yeah. So watch this space then. There's going to be some information coming out in the next few months that tells us where the key areas of interest and excitement are. That makes total sense. Coming back to this point around data, because at the end of the day, one of the things that I love about the transformation program, I mean, I sometimes refer to myself as a health systems geek. And the thing I love about Saudi Arabia is it's asking the perfect question. It's, how would you in 2025 create from scratch with the budget to actually be able to do it properly, a data-driven, digitally enabled healthcare system pretty much from scratch. You have got existing hospitals, existing facilities that you're encompassing, but you are really coming at it from that blank sheet of paper point of view. How then do you go about sourcing the data that you need? Because at the end of the day, in order to have that outcomes-driven, preventative healthcare agenda, you're going to need a ridiculous amount of data, aren't you? Not from the public sector, the private sector, from the well population, as well as the population encountering the system. Is there a strategy in place? How do you go about assimilating data at that level?
Yeah, there is a strategy in space, but I'm not the data geek, Steve. So I go and buy it. So and I'm not going to pretend after just 3 months that I'm not going to sit here and pretend I know the entire ins and outs of the data strategy. But from a just sort of how are we going to make this happen? It's all about working with global partners. in terms of sharing data, in terms of making sure we bring the right partners in that can bring the right systems and architecture in. Because as you said, we've already got a wealth of data. Number one, is it accessible? Can I get to it? Number two, is it all on, and I know for a fact it is, on different federated platforms. So again, starting to look, just like we did in the NHS, do we need a federated data platform that can bring all of that data in and put it into one place, and then we use an AI overlay so that we can start making sense of that data? This is all part of the strategy. As you'd expect it to be. But it's, because I said, there's a lot out there, but that's not usually the challenge. The challenge usually isn't we haven't got the data. The challenge is we've got the data, but we can't bring it together in a meaningful way and do anything with it.
Yeah, it's how do you access it, and how do you make sure that you've got the accuracy there, the ability to access it, and then actually create the actions that come out of it. It's great to see that it's being thought about in
definitely.
that way. Yeah. I guess my final question as we get to the end of our time together, what's next for Jacqui Rock? I mean, if you look at it from defence to healthcare, from the NHS to Saudi Arabia, what's next? The moon? Where are you headed next?
I was going to say, I've always fancied being in a movie.
Maybe I'll
go to Hollywood. Maybe I'll go to Hollywood, right? I've always wanted to act. It's like, why did I not do that? But anyway, but you never know, because I always look at these brilliant actors that sort of get Oscars, and they say, I only got into acting in my 60s, and I'm like, brilliant. There's options yet. No, but seriously, obviously I'm incredibly busy for the next, however many years that I'm going to be delivering the system here. I'll continue to be very focused on world healthcare, right? Because I think whether I'm in the NHS, whether I'm in the Saudi system, wherever, healthcare is a worldwide problem. Or let's not call it a problem, it's a worldwide partnership, and so I'm really, really keen to start sort of taking what we've done within the kingdom out to the rest of the world as well. So that sort of quid pro quo. Really, really busy for the next couple of years. But watch this space. It's always interesting to see where I pop up.
Isn't it? Just I think there's one obvious question that has to come out of the back of what you just said there, which is simply this: Jacqui, who would play you in the movie of your life?
Oh my goodness! Oh, that's a horrific question. Well, it would have to be lots of different people, wouldn't it? As the I'm not quite sure who'd play the 60-year-old me. We'll get someone like Helen Mirren or someone like that. I think she'd do a good job of it.
Fantastic, Jacqui. Thank you
Joanna
so much.
Lumley. Let's do Joanna Lumley.
Yeah. You know what? I can see that one. That kind of works. That does work.
Yeah.
Jacqui, thank you so much.
I'll do it myself.
Absolutely. I think that's absolutely the right answer. Thank you so much for your time, Jacqui. As always, it's been a blast. Look forward to catching up with you very soon. Thanks very much. And thank you to everybody who's listening. Watch out for more Health Beats, more podcasts coming up over the next few weeks. And I'll see you very soon. Thank you very much.